It's not just, oh, you're a little grumbly, which is what we used to experience. Now it's something that folks are they're just downright ugly. I don't know any other better term to say that and still be polite about it.
As the pandemic drags on and frustrations over COVID restrictions mount, those tasked with protecting BC's frontline healthcare workers at hospitals, COVID testing sites, and vaccination clinics say they're dealing with more challenging interactions than ever before.
We're starting to find a lot more people who are expressing their displeasures with mandates, whether they are mask mandates, whether they are vaccine mandates.
Tony York, Executive VP for PALADIN Security, which does security for most hospitals and healthcare facilities in BC, says his staff have been dealing with verbal harassment, direct threats, protests, and even keyed cars. And it's happening numerous times a day.
People are expressing their displeasures in some of the most unkind ways. I've never seen it anywhere in my career. And this is a year 30 for me inside of serving healthcare security.
One security officer who spoke to City News anonymously shared a recent interaction with a COVID-positive patient at a Metro Vancouver hospital.
He was basically harassing nurses, yelling at them. He's calling the security guards official slurs. He's trying to spit at us. He's trying to bite us as well. And all the nurses were trying to do were try to get a blood sample from him so they can treat him.
But the challenges and pressures aren't just coming from people opposed to COVID measures.
A lot of mental health related concerns, a lot of substance abuse that just happens in our communities. And these folks need help. And they're obviously coming inside of healthcare to go get that help. And they're not always in control of themselves or their faculties.
Often when someone's in crisis, there are very few options. The emergency department is a main space where people go and seek emergency care for mental health concerns.
Johnny Morris, the CEO of the Canadian Mental Health Association BC division, says his group alone has been seeing double-digit increases in people accessing their services.
It's been well documented throughout the pandemic that everything that's happening in the world is having an impact upon our mental health, including people who live with, who perhaps live with moderate mental health and substance use challenges that have worsened, and also folks who live with severe and persistent mental illness who perhaps have had symptoms worsen.
Both Vancouver Coastal Health and Fraser Health confirm their security teams have noticed an increase in challenging interactions. In a joint statement, the health authorities also say that they have had to significantly increase security resources at some of their COVID testing and immunization centers and acute sites.
If I could ask anything of them, remember these are folks too. They're humans and they're doing a job and they're being asked to do a job, and they're not the ones that are making every protocol.
In Vancouver, Monika Gul, City News.